Hi, everybody. Welcome to today's webinar, Employee Mental Health, Whose Responsibility Is It? According to a recent Fidelity Investment survey, more than 90% of those respondents said that they have expanded programs to support different facets of mental health. And that really got us thinking within the WebMD Health Services team, is that enough? So during today's webinar, we're going to have a real and honest conversation about how people are impacted differently by stress and anxiety, and share some different strategies for supporting them. You're going to explore how to advocate for mental health in the workplace, understand how to really empower leaders to address new and evolving stressors, and learn to help employees in a variety of different working environments. Okay, so let's get started. First, I would like to introduce myself. My name is Julie Mallory, and I am going to be your moderator for today's webinar. I am our events marketing manager here at WebMD Health Services. And just a few housekeeping things to cover. We're going to go over a lot of information today. So today's webinar is recorded, so you will receive this recording along with the slides in your inbox here in a couple of days, so you can go back, re-listen, or share with your colleagues. We're also going to have some time at the end for some Q&A. So if you have questions that come up anytime during the webinar, feel free to just add them into the Q&A box that you see right there on your home screen, and we will save some time at the end. If we don't get to them, we will be following up with you after the webinar, so don't worry. Additionally, you're going to see some additional resources there on the lower right-hand corner. We have a blog post on leadership and mental health in the workplace. You're going to see a link for our Meaningful Connections Guide, which is going to help you discover how to create some meaningful connections to increase your company culture. And then our Burnout Guide, which is going to go over what's causing and contributing to burnout and how to assess your workforce. And then finally, at the end of the webinar, there's going to be a survey that's going to pop up. It is a quick 30-second survey that we're looking to get your insights about today's webinar, and we use that feedback. We do appreciate it, and we use that feedback when it comes to putting together future webinars. So we really hope that you guys will just take a few seconds and fill that out. Okay, let's meet today's speakers. So we're going to do a panel discussion today. And first we have who's going to be leading our panel. We have Christine Muldoon. And Christine is our Senior Vice President of Marketing and Strategy here at WebMD Health Services. Hey, Christine, give me a wave. Hi. And next, we're so excited to welcome Dr. John White. He is the Chief Medical Officer of our parent company, WebMD.com. And Dr. White is a practicing physician and a corporate executive, and he has a unique combination of government and private sector work, which provides him with a great perspective on wellness, clinical trials, and information technology innovation and healthcare services. So we are so excited to have your perspective with us here today. Hey, Dr. White. And then we also have Melissa Voigt. She is our Vice President of Client Success here at WebMD Health Services. And she is going to be sharing some examples of how our clients are supporting mental health in the workplace. So Christine, I know we have got a lot to get to. I'm going to hand it over to you to kick off our panel and get us started.
Thanks, Julie. Welcome, everyone. So happy to have everyone here today. We do have a lot to cover. And I think to start us off, I wanted to share a little story. This is not my story. It actually comes from the National Alliance on Mental Illness. So here we go. Imagine a woman who deals with depression. In the late evening, she video chats with a therapist who tells her the depression is nothing to be ashamed of. She is lucky enough to have family members and friends who help her fight that stigma. They accept her depression. Then she goes to work in the morning. No one talks about mental illness. It's as if it doesn't exist. On the rare occasion she does hear about it, the conversations are not positive. Her coworkers don't have enough education to be sensitive. They accuse people of using mental illness as an excuse to be lazy or receive special treatment. She wants to believe her therapist and loved ones when they say her mental illness isn't a weakness. It's hard to, however, when no one at work is coming forward. None of the people she spends the majority of her time with are telling her there's nothing wrong with her, that depression is okay. I kind of wonder how many people have a similar story. And so today, we're going to have a real conversation about mental and emotional health in the workplace, and hopefully make the case that mental health is a dimension of well-being and one that should be supported in the workplace, just like physical health, social, or financial is. I think the silver lining that we've all been through over the past few years, recognizing somewhat that the glass is half full, is that we recognize the workplace is changing. We're becoming less bounded, I would say, by four walls. We're becoming more diverse and emphasizing the overall employee experience and how we can improve that. I think you've all seen the alarming stats around mental health, the idea that it is sort of the forgotten part of health. But I would like to share the positive stats as well. So according to the 12th annual employer-sponsored health and well-being survey, which was completed by Fidelity Investments and Business Group on Health, 92% of survey respondents have expanded their support for things like stress management, sleep improvement, and resiliency. 74% of employers have increased work-life opportunities. 64% have an enhanced child care support, which we know has been a huge factor of stress and burnout. And 83% have or will provide programs to support financial health. This is all great news. Employers are taking a second look at their benefits and focusing on the needs of their employees, including those needs impacting employee mental health. But today we want to make the case for all organizations to better support those struggling with poor mental health and share with you why it does matter. So with both Dr. White and Melissa joining me, we're going to discuss why it's important to empower employees to bring their authentic selves to work and open up that conversation on mental and emotional health. And on the next slide, you're going to see how we want to share how leaders can better support their employees and why we believe that employers do have a role in supporting and addressing mental and emotional health in the workplace. So to set the stage for our discussion today, I first want to align us all on the definition of mental health, because I think it's really important to recognize that mental health is not one thing. It's stress, depression, anxiety, burnout, even our ability to feel accepted. And while the pandemic has really started to bring, I would say, more awareness to mental and emotional health, many employees are unfortunately still afraid to seek help from either their managers or even HR for fear of being judged. This social stigma leads to employees suffering in silence and pretending to be okay, and really differentiating work life and everyday life. So if you are wondering why mental health is such a big deal in the workforce today, and if it really does make a difference for employers to support it, I'd like you to listen to this health coaching testimonial that we're going to play right now.
Hi, I just wanted to say thank you for providing this service. I started off with a health coach for exercise, things like that, but that person acknowledged that maybe I would benefit from a stress management coach. So once a month I've received a call from Sarah, and she has been extremely instrumental in me making such a positive change in my life. She has helped me to identify that I have things that I could change. I was able to go to my primary care, have that acknowledged, and receive directions on how to improve the depression in my life. So I really so much thank you, WebMD, thank Health New England for the opportunity to have this resource. It's been great. I think it even saved a life.
I love this testimonial because not only is this participant real and authentic, but we were able to help someone by, first of all, giving them access to the right support, acknowledging their mental health challenges, talking about it with them, and kind of going back to that initial story I shared when we first kicked off, letting them know it's okay and helping this individual make those positive changes. And I would say that even before the COVID crisis, I think we all recognize that mental and emotional health problems such as anxiety, stress, loneliness, depression, these were all widespread and they were impacting employee well-being and obviously affecting things like absenteeism, productivity, healthcare costs. And we know that there is a direct correlation between mental health and how it impacts our relationships with and at work. I also want to share with you on the next slide, we, in preparation for this webinar, we evaluated our book of business and we looked very closely at 2019 through 2021. And what we observed, and you see here on this chart, is there was an increase in our participants at risk for sleep, stress, and emotional health over the last years. WebMD also conducted research on employees' needs and expectations around support from their employers. And our research also found that employees do expect mental health support from their employers. In fact, we found that 7 in 10 people believe employers should offer a mental and emotional health program. So this is a perfect time, and we're going to have a conversation about all of this. So Melissa, I'd love to have you start the conversation with us today. And there was this Willis Towers Watson study, which found that 86% of employers are putting a focus on mental health needs. And I think since you work closely with our clients, I would love to get your perspective on how employers are supporting mental and emotional health, and are they making a commitment to really focus here?
Yeah, thanks, Christine. And the good news is most of our employers, like you said, 86%, they currently do have an offering to support mental health. And it spans from the health continuum, mental health continuum. But one of the things that our employers are looking to do is expand their offerings, right? Because we want to have offerings that are anywhere from prevention, stress, burnout prevention, all the way to those who may need professional care resources. And I just want to give you some examples of what our employers are doing. So for those that are healthy or may be experiencing irreversible distress, we want to offer some self-care programs and some social support programs. So self-care programs might be guided meditation, digital health coaching with a focus on stress management, educational podcasts, or even self-care challenges that actually focus on lifestyle behaviors that we know will impact mental health. So thinking about sleeping well, eating well, getting physically active, and even just going outside in nature all help with self-care. And we also have a large portion of our employees who are looking for social support, that connection that they want to have. So they're offering things like walking clubs or DE&I employee resource group coaching, or even informal coaching talks. And one of the unique things, which I think is great, are just some mental health breaks throughout the day. And these are just some simple, easy, quick things that you can do that really do make a big difference. And it can be as simple as hosting bingo or card making, planting flowers, or even considering over the holidays, gift wrapping stations. And while it may seem small, I again want to share a story of just a gift wrapping station and the impact that that can make. We had one participant, there was a gentleman that came in to wrap some gifts, and He recently had a divorce from his wife, and he wanted to make this Christmas really, really special for his children, as it was going to be the first Christmas alone with them. But he did not know how to wrap a gift. So having somebody there with him to teach him how to wrap a gift was a moment that he really needed to feel confident going into that holiday season with his family. They're also, our employers are also offering programs that focus on those who may have functional impairment or even a clinical disorder. So that can range anywhere from a one-to-one health coaching interaction, or EAP support, or even on-site counseling sessions. And then having the support for clinical disorders, such as strong health benefits, counseling or therapy, or even access to some treatment programs. And not only that, it gets more complicated than that, right? So there are programs that we want to do also focus on the root cause of some of the mental health concerns. So a lot of our employers are also focusing on adding some additional support when it comes to financial, fertility and parenting, pain management, caregiving support, and even substance abuse. So as you can see, Christine, employers are taking great steps forward in the mental health in the workplace. And offering some great programs.
Thank you, Melissa. I love that. I would take you up on the gift wrapping because that stresses me out. But I think the important thing here is that there are certain workplace factors, and there's a lot of them, right, that are negatively affecting our mental and emotional health. The change in the workplace, turnover, burnout. These are all maybe more newer experiences that we've had to deal with. I think until recently, the conversation has primarily centered around pre-existing mental health conditions and the related stigma. But I think what you've just shared a little bit more about, Melissa, is that we are seeing this shift to consider the workplace and everyone's mental health. So one of the things I think we should do now is sort of get a temperature check from all of you. So we're going to ask a series of polling questions. This first one that you see on your screen, how does your organization compare? We want to know, has mental and emotional health increased or decreased at your workplace in the last 2 years? So please check one. Has it increased, decreased? You can say it's maybe stayed the same over the last 2 years, or maybe you don't know. So we'll give it another few seconds here, and let's go ahead and see what the results show. 75% of you say it has increased. 2% stayed the same. I'll call out the 12.5% have said it's decreased. So, I will say I'm not surprised that, 3/4 of you say mental health has increased, because it is consistent with what WebMD has seen across our book of business as well. As we defined mental health in all of those different categories, we have definitely seen an increase over the last 2 years. So now let's ask what your organization is doing about this increase. So your next question, has your company prioritized mental and emotional health over other priorities over the last year? So your answer choice is yes, no, or it's been the same. And while we're waiting for the responses here, I'm going to share with you, there was research that was published in an article that was titled, "It's a New Era for Mental Health at Work." And it was published in the Harvard Business Review. And it stated that the resource most desired by respondents was a more open culture around mental health, which is not surprising, actually. So I'll share more about that research. Let's see how you guys all responded. This is great. So almost 65% of you say, yes, our company has prioritized mental and emotional health over other priorities over the last year, which is fantastic. Those of you that said it stayed the same, I mean, you could have already had it prioritized. So I'm not looking at that in a negative way either. the study I just referenced, their research also found that 54% believed that mental health was prioritized at their company compared to other priorities. So, pretty similar to what you all said here as well. And 47% of respondents believed that their company leaders were advocates for mental health at work, with 47% also believing that their manager was equipped to support them if they had a mental health condition or symptom. So I would like to know more about this particular area and your organization as well. So our next polling question and our last of the series, do you believe your company leaders are advocates for mental health at work? Yes or no? I think this question sort of gets to this idea that it's not just about offering solutions, but the need for real support, top down, a need for increased training about the existence of solutions and support, and really a more open culture and discussions around mental health, particularly when we know there's so much stigma, around mental health in the workplace. So let's see, do you believe your company leaders are advocates for mental health? This is great. Almost 67% of you say yes, and about a third of you say no. So, hopefully maybe we can help support a little bit here with the next part of our discussion. So I'm gonna bring Dr. White into the conversation here. Dr. White, I'm not sure what your thoughts are. Some interesting responses from our audience. I don't think anything super surprising about the state of mental health today, and prioritization of mental health. So my question to you is, how did we sort of get here? And maybe a second part to that question is, are there different groups or even generations of individuals that we should be more concerned about as it relates to mental and emotional health?
Sure. Well, thank you for letting me be part of this and really covering this important topic. I'll tell you, so I tend to be a glass more half full than half empty. So I'm encouraged by this, because if we asked these questions 2 years ago, the numbers would be much lower. And as you referenced, mental health issues were occurring there. So I think COVID has helped sensitize us to it. So I'm glad that a lot of folks are saying it's a priority. They're having strategies. We'd like to see it even higher and really drill down in terms of what employees are getting, but that's encouraging. I think what we have to recognize, and we see this on the next slide, is that we really have a mental health tsunami upon us. We've spent so much time talking about COVID as an infectious disease pandemic and have focused on the physical manifestations of COVID that we sometimes have neglected or not addressed as much as we need to the mental health aspects. And roughly a third of people have said that their mental health and well-being has gotten worse over the past 12 months. 32%, that is a big number that is going to manifest itself and is already doing so. So we have to recognize that. And even at WebMD, we saw dramatic increases in search around anxiety, PTSD, search around certain medications that would be used for that in depression just over the last 2 years. And when we think about who's most impacted, I think about it even in my own clinical care. It presents differently based on sex, race, age, gender. And what we do see is that younger generations of employees are facing more mental health struggles. And, maybe I'd say, with age comes wisdom, right? So in some ways, how to manage some of life's difficulties, right? That get in the way of happiness no matter what. But we have to recognize that the younger generation, often employees that are just starting have challenges. It's the issue of culture. It's the other aspects of starting a new job. It's the aspects of uncertainty, the uncertainty of the pandemic, the uncertainty of work requirements. So I really want to point that out, that we need to be particularly sensitive to the younger generation of employees and recognize, and I've said this a few times over presentations, we really have no physical health without mental health. And they're really tied together. And the point about that is, poor mental health can result in other, health conditions. We see that insomnia, an inability to sleep is often a presentation. Fatigue is a presentation. There's lots of life changes and stressors that go on pre-pandemic and that are continuing now, the issues of burnout that we've talked about. So we really can't say, oh, hey, mental health is here and all the other aspects of employee health are over here. That's why I love that we're talking much more about employee wellness, mental health, well-being. These can't just be terms that we're using, but really have to be the way that we address how we manage the overall wellness of employees.
So I wrote down a couple of things you said because they really stand out to me. Age comes wisdom. I will agree with that.
That's because they're getting older.
The tie of physical and mental health, I think, is important because, when you are feeling stressed or burnt out or lonely or depressed, it impacts your ability to kind of function through the day. And so that statistics you had on your slide about 32% of people saying that their mental well-being got worse in the past 12 months. So does that mean then that the pandemic alone is the main cause of this mental health revolution or tsunami that we're seeing today? Or are there other changes that are really impacting overall well-being and mental health that is really maybe more bringing this to the forefront today?
Right. And we see this on the next slide. Certainly the COVID pandemic has played an important role in terms of employees' mental health. But I don't want folks to think, well, that's the only thing that caused it, because clearly it isn't. Family and relationship issues are often a source of stress, anxiety, and creates mental health challenges. So that continues to play a role. We know the role of economic uncertainty. Whenever there's uncertainty, there's anxiety and stress. But certainly if you're concerned about paying your mortgage, getting enough food on the table, making your car payment, you are going to be very stressed, and that's going to create a lot of anxiety. And we know right now, in terms of the issues of inflation, we don't have it on this graph, but, let's be honest, right now it can be very stressful to turn on the news in terms of the geopolitical events. And that can be a challenge for folks when they're trying to do their job and live their lives. And obviously it's the workplace related stress that's unrelated to COVID. That's part of all of our daily lives. So sure, COVID certainly has played a key role, but let's not think it's the only one, because here's an important point to consider. When the COVID pandemic ends, and it will end, we're making progress, we're having some blips along the way, and that's causing uncertainty for people, but we will get beyond it. The issues that will continue in terms of mental well-being are going to persist for many more years. It's not like all of a sudden all the challenges that COVID has presented are going to make everything go away, because they're not. They're a big component, but they're not the only component. And we're still going to have a lot of work to do once we resolve, the issues of the pandemic.
I think that these top 4 issues that you're sharing and the top 4 that are affecting mental health over the last year, those all make sense to me. I think it also sort of leads us to recognize that employers must move from seeing this idea of mental health as an individual challenge to more of a collective one, because it's not just one person. These things are impacting many. And I think we can no longer group mental health as this individual responsibility then, and that we have to address it all alone through self-care. If you think back to the definition I shared earlier, I said that mental health includes our emotional, our psychological, and our social well-being, and it affects how we think, we feel, we act. So there are really so many elements to this mental health discussion. I think we're ready for another polling question where we'd love to know looking at the glass half full at this point, what elements or strategies has your organization implemented? And you can choose more than one at this point. So, have your leaders prioritize mental health? Has your organization invested in DE&I as part of your mental health strategy? Have you implemented a mentally healthy culture that incorporates things like flexibility? And has your organization implemented organization-wide opportunities for creating meaningful connections? I think this one goes back to a little bit of that social factor of mental and emotional health. And, all of us obviously maybe still working virtually or hybrid. We don't have that opportunity to connect with our peers and create those meaningful connections. And we know that can have an impact on mental and emotional health as well, particularly loneliness, which then impacts, our presenteeism. So, okay, let's see. What did people select, Julie? We have implemented a mentally healthy culture, about 77%, followed by, I couldn't see the full results here. Sorry. Okay, let me pull this down a little bit. Okay. 61% organization-wide opportunities for connection, and then investing in DE&I, which I think is important as well, and then that top-down strategy. Fantastic. This is great. So, okay. So, Melissa, we see that many participating in this webinar today have certainly implemented a few strategies to really focus and support employee mental health, which I think is great. And there's a good mix that we're seeing here. But I think the question to you then is, why has it been so difficult to get people to focus on their mental health in the workplace?
Yeah, it's such a hard question for all of us. And yet, this is something that we, all of the leadership within the organizations, those of us running well-being programs are taking a look at, and fundamentally, what is the reason why? Because that's where we have the opportunity to focus, our attention and our interventions to help break down some of those walls. But I feel like the first one, certainly is with the employee of, if well-being is so common, which it is, right? According to NAMI, at least 1 out of every 5 of your employees is experiencing a mental health issue in any given year. So it is common. But yet, we're not willing and open to talk about it. And that can be for several different reasons. And the truth is, employees may just not feel comfortable sharing in the workplace. And oftentimes they might actually be expending a lot of energy actually trying to hide their mental health issues. And, again, kind of exploring why that may be, some people may want privacy. Others, it is certainly due to the stigma that remains. We're doing a good job, right? I mean, the stigma is coming down. We're making progress, certainly, but it is still there. They may feel that there could be repercussions that come from sharing from their management team or leadership team. They could have that fear of being labeled moving forward. But there is just something that maybe they're not prepared to share. Other things that could be happening is the employee themselves, if they're going through something new, they may not know the feelings that they're experiencing. It could be new to them. And sometimes those feelings are, it can be very intense. It can be scary. They may not know how to actually put it into words. So just like Dr. White said, even starting to look for behaviors that are changing or signals, it might be helpful for even people to share with those that might be going through it. So, and I think another thing is employees may not know that they can ask for help in the workplace. They may not feel that they can either talk to their manager about it or a coworker. So there's certainly a couple of reasons why we're having those problems with employees. But I feel like another reason is sometimes I think the relationship with their managers becomes an extremely important relationship. And one of the things that also could be happening is that our managers may not feel prepared to have the right type of conversation with an employee who may be reaching out for help. managers may, not be able to recognize when their employees need help. So, continuing to train our managers to take notice of observable behaviors. Is their behavior out of character? Are they shutting the office door more frequently? Are they turning their camera off more than usual? Is their appearance a bit disheveled or off-brand? But all those things is a good opportunity for our managers to be able to open the door and do a check-in just to see how the employees are doing. And the employees, go ahead.
No, go ahead. I was going to add.
Managers also may just not feel prepared to have a productive conversation. They may not know what to say or what not to say. They may not know that they can get coaching from their HR team. All of those things are things that we need to be able to help managers do in order to be able to, have the right type of conversation with the employees to start to talk about it. Dr. White.
And this is how you can tell it's a real discussion. So we're interrupted. I was going to add the other point we have to recognize is that people can ask for help in different ways. They're not necessarily going to say, I need help to manage this personal issue going on at home, unless the culture is there. And the reason why I say that is, I saw a patient a couple weeks ago. His diabetes is not as well controlled as it should be, but it's been like that for quite some time. It wasn't just during the pandemic. And he wanted a note that he would not have to return to work. And I will tell you, in the discussion with him, it wasn't relating to the diabetes. It really was relating to the anxiety that he had about return to work, that there was a lot of uncertainty that had been going on. So he didn't come in to talk to me about anxiety. He came in to talk to me about his diabetes control and then not wanting to return to work. And I think we have to keep that in mind. And also, we always say meet people where they are. But in that sense, it really was listening and understanding what were his concerns and expressing that and acknowledging that's okay. And that can be sometimes when people say they have to, leave early, and they may not want to say why they have to leave early. Maybe they have to take care of, a sick loved one, and that's creating a lot of stress for them. And we have to, be present and give people the opportunity to go further and explain what's really on their mind. And that's really what I wanted to point out. People will ask for help in different ways.
It's a valid point. I think we definitely need to recognize, going back to the testimonial I shared, earlier, that individual didn't know, and the health coach helped her recognize the depression in her life. So a lot of times it's more of that education to get people to focus because they're not aware. And then again, Melissa, to your point, it's also about helping managers be equipped to have those discussions and make employees feel comfortable as well. So manager training as well as education for individuals are also relevant and important. So Dr. White, I'm going to ask you this next question since you are obviously a strong advocate for well-being. I'd love to get your perspective as to why employers are being asked to engage in questions around personal and mental health. Like, is that a good thing? Why are we asking employers to do this?
I think it's a very good thing. For a lot of employers, it's a new thing. And for employees, it's a new thing. And it's recognition that we've been talking about for the last 40 minutes. Mental health and physical health are, integrally related, and you can't have one without the other. And poor mental health manifests itself not just at home, but also in the workplace. And employers need to recognize that when we're trying to create a great work environment, if we fail to address employees' mental well-being, we're not going to succeed. We often talk about nowadays how health happens outside the doctor's office, meaning it's not just what happens with your blood pressure and your lab values when you come to see me on a certain day, but it's also what's happening when you're at home, when you're in the office. What is the environment that's addressing your overall health issues? So that's why it's so important in terms of, asking these questions about personal and mental health. And we all say we care about our employees, we care about our colleagues, and this is one of the ways that we manifest it.
So I am going to bring up our next question. And Melissa, I'm going to give this to you because this is like the number one question that gets asked, and it centers around engagement. Because we can have all the amazing programs and benefits, but how do you get employees to engage or participate in mental health programs, and really, show that they are important and they can be valuable? So, Melissa?
Yeah, no, it is the age-old question of, how do we get people engaged? And I'll give you 4, I think, tips in terms of how we can increase participation and engagement. And I'm not just talking about structured programs either, but just engaging in the workplace in a way that will help them, manage their stress overall. So the first thing is, and this is often the most challenging, is we do need employees to know what's available to them. We still honestly do have a gap between, you might be an employer right now on the line saying, I have all of these great mental health well-being offerings. How come nobody's using them? One of the things is continued and ongoing communication with your employees and even your managers around what programs are available. We know, 86% of employers are offering program, but only 57% of employees are actually aware that those benefits exist. So we need to keep constantly communicating. And then also making them easy to find. I'll use an example. For anyone that's suffering from depression, finding a therapist, first of all, understanding that they want to engage with a therapist is a big moment. But finding a therapist can be an overwhelming process. Who do I call? Who do I reach out to? How do I use my health plan? As an employer, that's where I do believe we have a responsibility to make that information as easy as possible. So when somebody's ready to take that step, they have the information that they need in order to do so. I also think it's, our responsibility to offer programs across that mental health continuum. So let's not forget, the kind of keeping healthy people healthy, having some of those stress management programs, self-directed programs, those are really important to make sure that we have. So whether it's the modality offering, whether it's, self-directed online, in person, or offering coaching, but also having the right intensity level is important. So no matter where somebody is in their journey, they can find support that's going to help them really kind of work on their own mental health. This one's big, and I feel like could be a whole webinar on its own, but is creating a company culture that really allows employees to bring their real, authentic, imperfect selves to work, right? This is where we need to think bigger and go beyond traditional engagement in a mental health program and really have our leadership team, senior leadership, mid-level leadership, make it culturally acceptable to engage in some of those burnout strategies. Simple things, taking a screen-free lunch, taking a walk break outside in nature, taking real PTO to rest and recover. All of those things are really important, and allowing employees to find real connections with each other and having real conversations and making it okay for team members to have a slightly off day or talk about their struggles, or ask for the support that they need. This is where hard work comes in as a company and a company culture. And this is where we can really instill some of that change to help people even, start to participate in well-being programs. And again, I can't emphasize this one enough, is providing your management team support. Our managers are on the front lines working with employees. And oftentimes they're in their role because they excelled at the job that they're in. And many may not actually have any formal training on how to be a people leader. So offering your managers ongoing skills training on the resources that you have available, but making sure that they feel comfortable when they need to have an in-moment conversation, that they know how to have the conversation, but they also know the resources that they can point people to. So in addition to that, on the next slide, our clients are getting really creative in how they engage their employees. So going beyond, earlier in the webinar, I was talking about some of the programs that our employers have available, but others are saying we need to change it up. We need to do something different to make it interesting. And I just wanted to share a couple of unique examples of what our clients have done. And one that was just absolutely fantastic is we had one of our employer groups actually roll out a social justice challenge. And this was taking a combination of things, which mental health is, right? Taking a challenge that encouraged participants to get outside, get their steps in, but at the same time, stopping by a digital cross-country journey to actually focus on racial justice movement in particular places. For example, they explored Montgomery, Alabama, where Rosa Parks was arrested for refusing to move on her bus seat. Little things like, and I should say, connecting that in with the podcast. So there was education behind it, but also encouraging, people to get up and get moving. We had another great example of one of our clients. We were in the heart of the pandemic, and they wanted to know what their employees needed during COVID. So it's simple, but just ask them, right? What are you looking for? And so they used one of our pulse surveys, and what they found out is people were actually just wanting some time for self-care. So they spent an entire week and they rolled out a dedicated self-care program. In addition to that, we have dedicated on-site staff that work, throughout the country with our employers, helping to roll out programs. But what they're really doing is helping generate awareness, infuse that excitement, establish those personal relationships that can help increase participation. So again, kind of going back to some of those fun programs like card making, walking clubs, painting classes, coffee chats, getting people together to talk about similar issues. And we even had one client, which was great, again, meeting people where they're at from a content perspective that is moving away from a traditional webinar and putting some of this information on podcasts. So again, encouraging people while they're on the go or doing things that they, in their personal life, podcasts are really easy ways to keep that education going, where they're taking a look at the data of what their employees need and able to bring in health experts to have conversations around very serious topics. So as you can see, Christine, our clients are continuing to expand the program offerings. They're getting really creative, but really trying to figure out how we best engage.
I love it, Melissa. And these are just great examples that, yes, you can have an off-the-shelf program, but then you also want that program to reflect or be an extension of your culture as well. And so these are just hopefully spark some ideas for some of you on this webinar. So we have one last polling question for everyone. As I said before, today's webinar is titled Employee Mental Health, Whose Responsibility Is It? So I ask all of you, did we state our case? Because we absolutely believe that employers play a role in supporting employee well-being, including employee mental health. So do you agree? Are employers responsible for supporting employee mental health? Yes, no, or maybe do you feel like it's only under certain circumstances? So we'll give you another second there. And Julie, can we go ahead and see the results? Yes, we did it, guys. Everyone believes. Well, most. And you know what? I also understand the certain circumstances as well, because that does leave a little bit in terms of flexibility, in terms of depending on your culture and your overall organization and your population as well. So that's great. I'm so glad there. If you all now feel empowered and ready to make that commitment or continue to evolve your culture and what you do for your employees' well-being, we do want to just kind of wrap up this webinar with maybe 3 ways our attendees today can advocate for employee mental and emotional health. So maybe I'll have both Dr. White and Melissa kind of tag team here. And we'll start with you, Dr. White. Give us a way that they can advocate for employees' mental health.
Well, I do want to go back to even when I want to give 2 real life examples. And I had not even mentioned this to you ahead of time, but I just thought it now. Because a lot of people, we're walking, we're doing the talking the talk, right? And saying it's important. But then how do we actually make that work in the environment? And 2 real life examples, friends of mine that started new jobs in the past couple of months, and their employers talked about how employee wellness is important. And the one friend told me, they've been talking about employee wellness in the recruiting stage, and he noticed when he went to his manager's office, because they actually met in person in the office, the manager had a no whining sign, right? So what message does that send? And I will tell you, as part of residencies, I've seen that sign and I never liked it. Even back then, I was saying that was wrong. So what message does that send? You're talking all this about wellness, and then you have that kind of sign. And then the other one started recently at a well-known company, and she said to me, there were 3 weeks of webinars and sessions. She couldn't get her own work done because she was constantly doing this onboarding. And she was like, I'm stressed over it because there was too much to do, and there wasn't that balance. And at some point she needed to get her work done. So I just want to point that out, how important it is when you actually go about and do it and evaluate it. But I do think people, need to be advocates. They need to talk about the specific services they may need. I think we have to make the conversation easy to have. It's, what we've talked about. It's creating the right culture, right? So that culture of a no whining sign is not the culture. And having too much when you first start that you can't get work done, you're having anxiety, is not the culture either. And I think it's going to take some iteration over the next couple of years, but it's got to be front and center and not siloed as it has historically been.
Melissa, your thoughts?
Yeah, I think, when we think about mental health and where we want to go, I would encourage us to think about, the mental health continuum and the experiences that we want to have within that continuum. I will always, believe that culture and managers are a big component of this, but I would encourage all to think through what the employee experience would be, anywhere from those who we are trying to prevent burnout, those who are at burnout, but we want to retain them. We want to keep them focused in, their role and their job, and support them, possibly making accommodations to help them so that they can be productive in their roles. And all the way to those who may need to seek care. And what is that journey from the time you know that you need care until you're getting them to the right place? So thinking through some of those, I think they call it journey mapping or member experiences or participant experiences, those things will really help us in kind of putting the pieces together, because we all know here, right? It can be complicated, and it can get complicated really quickly. And if a person is at a place where they need help, we just need to try to make it as simple as possible to be able to find the care that they're looking for and that they need.
Perfect. We look at mental health and we talk about it like it's a bad thing, but I think we need to recognize that we all should aspire to have mental health. And I think that's the part that we miss. I also want to encourage you all, before we jump to our Q&A section, to consider listening to the WebMD Health Services HR Scoop, which is our podcast, season 4, episode 2, specifically, where Andrea Herron, our head of people, shares a very personal conversation with her sister and her personal story around mental health and what it looks like from the employee perspective. So really encourage you all to check that out. Thanks, everyone. I think we're going to open it up at this point for a few minutes of Q&A. So Julie, I'm going to turn it back over to you.
Yeah, you guys, thank you so much. That was such a fantastic conversation. I enjoyed it, Christine. I was like you. I was taking notes, nodding heads. Really, really, really enjoyed that. Dr. White, first question comes from you, and to you, and you did mention this, but I'm wondering if you can come back. What are some signs to intervene on an employee you think is struggling, and how do you address it?
Yeah. Often it's some change in behavior. So it may be people now are consistently late, even, signing on if you're doing virtual, whereas before they were always on time. Or, it was also mentioned maybe the camera's now off more often than it was before. often we see in terms of personal grooming that people don't care as much about their appearance. It's really looking for any type of change in behavior. Maybe it's statements that they're making that seem out of character. If that's the case, that's when you do want to, have that conversation with employees, and hopefully the culture, is there that exists to say it's okay not to be okay. And then it's about how do you support that employee? Is it some modification of the work schedule? Is it making sure that they're able to take time off when they need it? Is it, putting them in touch with professional services as well? But that's the whole point of getting to know your colleagues and recognizing when there's a change in behavior that you want to ask about. And sometimes people are afraid to ask because they don't want to open that can of worms. But, there's no harm in making sure people are doing okay, and then following up as you need with them to get them the help they need.
Yeah, that's amazing. I know I started my own journey like 2 years ago, and I was scared to tell people. And now I'm like, oh yeah, I have to go see my therapist. Oh, I have a therapist appointment. I'm trying to break down that stigma for myself personally, while also like letting people know it is okay. There is nothing wrong with it. So that's great. Thank you. I appreciate that. Christine, somebody just chimed in, wanted to know the podcast information again. Can you repeat yourself?
Yes, HR Scoop, which is WebMD Health Services podcast. You go to our website or your normal podcast app. HR Scoop, and it is season 4, episode 2.
Great. Season 4, episode 2. Fantastic. Thank you. Another question came in. Will you guys send the slides out? We're not going to send the slides out, but you will get this recording in your inbox, which will then have the slides as well. So you can share it with your colleagues. If you found something riveting that you wanted to share along, you'll be able to share that with them. Is there any guidance or example for crafting a company policy to support mental health? Who would like to take that question?
I can take that one. First of all, wonderful question. And I love the idea of crafting a company policy to support mental health, because what better way to, clearly articulate what it is that the company will support. It may be policy, but it also may be some behavioral components as well. But I would, my recommendation, and we can certainly talk about this at a much deeper level, but, we want to get support from the senior leadership. I think this is a great opportunity for senior leaders to be able to articulate the type of culture they want and put it into words. I think, one thing that we do at WebMD is share with our employees, right? We want them to bring their true, authentic, imperfect selves to work every day, because that's where magic happens, right? We want people to be very authentic, very true to who they are, and being able to share that during a all company meeting and being able to reinforce that is a great way for, to bring the whole company along, whether it's managers and all the way to the employees. So, I think in terms of guidance, we can certainly talk through what should be included in that, but I strongly encourage everybody to consider talking through, what a policy or manifesto would be.
That's great. Thank you so much, Melissa. Okay, we are at time. One other question. Somebody said, when will the slides be in my inbox? We are going to try and get those slides to you by the end of this week. So look for those coming up quickly. We are at time, and we got a bunch of questions we did not get to, so we will follow up with everybody individually to make sure those questions are answered. Christine, thank you so much for your leadership and leading this panel discussion. Dr. White, thank you for your insight and your professionalism. We really appreciate it. I hope you'll come and join us on another webinar. We loved having you. And Melissa, thank you for sharing all of those wonderful client stories. To everybody that joined us, I hope that you were able to take something home with you. Thank you so much again. The survey is going to pop up after this. Please just take a few seconds, fill that out. We really appreciate the information for our future webinars, and we look forward to seeing you guys on our next webinar. So take care, everybody. Thank you so much. Have a great rest of your day.
Thank you.